with UNHABITAT. I am Yumiko Asayama, manager of Japan Water Forum, and also the coordinator of the Asia Pacific Water Forum as a secretariat. Today, we welcome the 6 speakers from UNHABITAT in Asia Pacific and discuss WASH as entry point to reduce COVID-19 vulnerability and other hazards. Before we move on to today's presentation, I would like to introduce today's housekeeping information. If you have any question and feedback, please add your comments and feedback on the chat box. We will try to respond as much as possible during the webinar, but if we couldn't find enough time, the speaker will respond to all questions and comment by email to you. And this webinar is recorded, and we will upload the recording to the APWF homepage as well as the YouTube after the webinar. Now, I would like to kindly invite Mr. Atsushi Koresawa. He is the UNHABITAT regional representative of the Asia Pacific. He will, introduce the overview of the UNHABITAT response, and also he will also lead his colleague from Asia and Pacific. Koresawa-san, now the floor is for yours and for your colleague.
Thank you. And can you put up our slide?
Yes.
Okay. Hello, everyone, and thank you for inviting United Nations Human Settlement Program, UNHABITAT for short, and giving us the opportunity to share our experience in the Asia Pacific region. You can go to the first slide. Yes, and UNHABITAT's mission is a better quality of life for all in urbanizing world. And we are engaged in over 90 countries to promote transformative change in cities and human settlement through knowledge sharing, policy advice, technical assistance, and co-creation. Next one. Our headquarters in Kenya and housed in so-called UN office in Nairobi, along with UNEP, our sister UN agency. UNHABITAT has 4 regional offices in the world, and one of them is my office, Regional Office for Asia and Pacific, which was established in Fukuoka City in Japan in 1997. I must say, this is a rare case because almost all UN agencies have regional offices in Bangkok, which is a UN regional hub for Asia Pacific. Our office covers 42 countries, among which we are running operations in 17 countries. UN office at this scale is also rare in Japan, with only exception being UNU headquarters in Tokyo. Now let me turn to the main subject today. It is exactly 1 year ago when WHO declared COVID a global pandemic, and COVID pandemic has been unprecedented and the biggest challenge in our lifetime. It started as a health crisis, yet from the very beginning, UN system has been responding as a humanitarian and socio-economic crisis. Indeed, UN Secretary General Antonio Guterres said the COVID-19 pandemic has disrupted lives and economies around the world. The social and economic fallout is reversing the development gains, and global poverty is expected to increase for the first time in the 3 decades. He further mentioned, cities have borne the brunt of the pandemic. The most vulnerable to disease are those living on the margins of cities. The COVID-19 pandemic has exposed deep inequalities and demonstrated that tackling the virus is more challenging in urban areas where access to quality healthcare is uneven, housing inadequate, water and sanitation lacking, transport infrastructure patchy, and jobs precarious. To complement, let me give you some facts and figures from UN community. Potentially, as many as 150 million additional people will be under the poverty line, $1.9 a day, by 2021. More than 270 million people have been put directly at risk of acute hunger. the so-called new poor are living in urban areas who are better educated, working in informal sector, and less likely to work in agriculture. It disproportionately impacted vulnerable groups, thereby exacerbating existing inequalities, structural inequalities, who are self-employed, informal workers, female, migrants, people with disabilities, and so forth. To respond to the crisis, we as the regional office developed a COVID-19 response and recovery strategy and started collaboration with government at all levels to provide essential services, in addition to policy advice and technical support of various kinds. Against this backdrop, we have decided to put the spotlight on importance of WASH in relation to COVID-19 and other disasters by sharing our hand-on experience and lessons learned on the ground in Fiji, India, Laos, PDR, and Myanmar. Without further ado, let me hand over to Avi, who is coordinating the session. Over to you, Avi. Thank you.
Thank you, Atsushi-san. If we can go to the next slide, please. Yeah, good afternoon, good morning, good evening, depending on which time zone you are based. As introduced by Atsushi-san, we note that structural inequalities have worsened as a consequence of COVID-19. At the same time, what we also observe is that the impacts of the pandemic have substantially increased inequality. So comprehensive assessments are needed to properly address the issues of vulnerability and better design response strategies. UNHABITAT, we have developed a water sanitation and hygiene in informal settlements and COVID-19 paper. And if I can quote from the paper, it says that the collection of community-led, georeferenced and disaggregated data is a key element of disease surveillance systems and can be used to ensure WASH services are provided to areas where they are lacking, unquote. So we see that overall this COVID-19 recovery window is an excellent opportunity to reduce the poverty gap and move a step forward towards advancing equity and inclusion in human settlements. So this brings to the next part of my presentation as we realize that we are facing a unique opportunity to mainstream green growth and climate action into response projects and plans. International organizations such as UNDESA, Organization for Economic Cooperation and Development, OECD, have drafted recommendations for a green recovery. And several other agencies are also engaged in this sort of similar endeavor. So this is an excellent opportunity for improving sustainable and inclusive access to basic services, which is to focus on maximizing access to safe drinking water, promoting good hygiene practices, and ensuring that vulnerable population receive priority attention. Improved access to WASH, we all understand, is key and critical. And to successfully achieve it, it is very important and imperative to better coordinate interventions at the local and at the national levels, to work with the local, provincial, and national governments, and engage with other development partners. Next slide, please. You will see that climate change is, of course, a major threat for WASH. Thus, climate resilience should be mainstreamed into the development of recovery response strategies. Multi-sectoral analysis such as WASH needs assessments and climate vulnerability assessments are complementary, and they are much needed to improve the quality and impact of localized interventions. Recovery after COVID-19 may be a unique opportunity for strengthening the existing systems and also improving preparedness and better adapting to the climate change related challenges. So that brings to the end of my presentation. And as you will note that Atsushi-san's intervention and my intervention provides a sort of a preamble for the 4 country presentations, which cover different facets of methodologies, approaches, tools, and interventions related to WASH as an entry point to reduce COVID-19 vulnerabilities and other hazards. So I would request my colleague, Inga, from Fiji to deliver the next presentation. Over to you, Inga. Thank you.
Thank you very much, Avi. And a warm welcome to everyone who's listening in. My name is Inga Korte, and I'm the team leader for urban climate resilience for UNHABITAT, and I'm based in Fiji, in the heart of the Pacific. And thanks, Avi, for setting the scene so perfectly, because my presentation is about giving examples from our work here in Fiji, and it touches upon exactly what you've just said. It's about closing the data gap, and we're looking at WASH and informal settlements, and we're looking at it from a COVID-19 and a climate lens, as we know both of them are directly intensifying existing WASH-related challenges. So before I go into detail, just a footnote that after the initial COVID outbreaks last year, Fiji has been extremely successful in keeping the country COVID-free for over 300 days now. So while the health impact of the crisis has been extremely limited so far, the closure of borders and the related socioeconomic impacts have hit Fiji really hard. So I'll talk about the COVID-related challenges here more through a climate lens. Overall, the population is roughly 880 people, and out of that, 123 live in urban informal settlements. That makes around 14% of the total population, or 25% of the urban population, which is quite a high number. And even though the number can compare to huge numbers like in India or Asian countries that live in slums or informal settlement, compared to the overall population, it's still quite high. And for Fiji or informal settlements, besides the lack of formal land tenure and inadequate basic service provision, one of the main features is that they are oftentimes located in vulnerable and hazard-prone areas, and they're thus highly susceptible to climate change. Our data collection here that provides the basis for this presentation, data here in Fiji is really scarce, and other presentations will touch more upon methodologies and tools that we use. But I just wanted to quickly summarize that how we collect data here. So we use a little bit of publicly available data from the Statistics Office, but we build a lot on vulnerability and risk assessments that we've carried out in selected cities and settlements. Because in the absence of data that's publicly available, we realize that we really need to do our own and thorough data collection that's especially related to climate resilience. In addition to that, we've carried out rapid assessments to understand the impact of COVID-19, and especially in informal settlements. And we looked at it in terms of health, knowledge, awareness, livelihoods, food securities, land tenure, etc. So building on that, next slide, please. Yeah, thank you. Before I go into detail on the situation in informal settlements, I just wanted to highlight that the overall access to WASH in Fiji is actually fairly high. I think we'll hear from India later on where the situation is quite different. But in urban areas in Fiji, we have a rather high access to drinking water, even though that doesn't necessarily include water quality or consistency. But still, also the general access to basic services is rather good. And there is a standard level of safely managed waste treatment in the urban centers in Fiji. However, if we look at the situation in informal settlements, it's really quite different. And just to remind, 25% of the urban population do live in informal settlements. So even though access to water is usually not so much an issue, it can be rather inconsistent and of inadequate quality, and especially during times of disasters. And especially the Pacific disasters are really frequent. For example, just since the breakout of COVID-19 last year, Fiji alone has experienced 3 tropical cyclones in the Sekasaiyan category. And last year during the initial breakout, when Fiji also recorded cases of COVID, we were exactly right then hit by tropical cyclone Harold with strong winds and flooding, and we had water cuts, and several settlements had to be evacuated. And that put many people in a position where they couldn't practice safe hand washing for a prolonged period of time, where they had to spend time in evacuation centers. So COVID-19 and climate change here are very closely linked. Also in informal settlements, the sanitation facilities are oftentimes shared and mostly inadequate. As you see in the graph there, it's from the study of one of our settlements. Most people do share facilities, and most facilities are not connected to a septic tank. And for those that are not connected to a septic tank, the wastewater disposal goes into drums or pits, and sometimes even open defecation. So you can imagine that in times during cyclones or flooding, this really creates horrible conditions in settlements when you have wastewater being spread throughout the settlement during floods. In addition to that, there's inadequate waste disposal and really poor drainage systems that further add to the challenge. And our rapid assessment furthermore highlighted that there's a general lack of awareness as well as a follow-through of safe hygiene practices. So even if people had access to the right facilities and water, they wouldn't necessarily follow through with it. For example, 20% of our survey responded that they were never or only sometimes following safe hand washing. And that was during the height of the outbreak, when there were so many campaigns and trainings everywhere. So that really highlights the importance of awareness campaigns and that reach also people in informal settlements that are not connected to a formal network. Next slide, please. Okay, so to summarize the major challenges in informal settlements, and that is broadly speaking, what we'll see that most of them come back to climate change and WASH, because they're oftentimes really interconnected. We have high rates of poverty and food insecurity, and that was even worsened now during or after COVID-19. Because Fiji is highly dependent on tourism. Pre-COVID, over 30% of the GDP was related to tourism, and now the closure of borders and travel restrictions have severely impacted livelihoods. And that is true, especially for informal settlements, where people worked in the tourism sector, in the service sector, etc. And I've not yet really gone into detail on the informality of land tenure, but really besides the lack of the formal land title, informality really here means that settlements are disconnected from the formal networks and they receive no or very limited municipal services. There's generally no enforcement of building standards or WASH standards, and especially related to WASH, informality then also contributes to a lack of investments in adequate facilities and systems. So, and both related to climate change and COVID-19 is the general lack of awareness and follow through on safe practices. That is true for COVID-19, but that is also true, for example, related to waste disposal. You'll see in that picture, that is from one of our settlements, and that water is the main water source for the settlements, where people wash their clothes and they use it for washing their dishes, for example. And the trash is just alongside the river. So we really know that there's that awareness and behavior change is also a major component. Next slide, please. So as a way forward, and where does that lead us now? So to begin with, we really need to focus on mapping and understanding where all the informal settlements in Fiji are located. Avi pointed that out. Without proper data, there's really we really don't have the right tools at the hand. At the moment, we work in pilot settlements and pilot cities, but we need to really focus on locating all the over 270 settlements, and then and classifying. Some of them are located near to rivers, so we know that flooding might be an issue. Some of them are in the mangroves. So to really come up with an index of what the highest or the major vulnerabilities are will be the first step. Then we really need to invest in long-term and more strategic the issue of land tenure to address that, as well as socioeconomic aspects of poverty and food insecurity. And then lastly, really, as I mentioned before, we really need to address the lack of awareness and knowledge on safe practices, especially related to COVID-19 and hygiene. And just as a reminder for us here that informal settlements just need a targeted approach, because they are not connected to the formal networks. So that's a small insight into Fiji, and I think I hand over now to Parul from India to tell us about the situation there. Thank you very much for listening.
Thank you, Inga, and thank you everybody for joining us today. I will share our efforts to focus on building back better, and especially in the WASH interventions in India post the COVID crisis. Next slide, please. So India is the second largest country, and it's also the second most affected country in terms of the confirmed cases. And the severity of the crisis is quite high here, with the country also ranking 4th in the COVID-related deaths. With the migration issue in India that also got global coverage, largely due to the reverse migration from urban to rural areas once the lockdowns were imposed, resulted in the concentration of COVID increasing in the poor districts where the migrants were going to, and with this and in keeping with the concerns even in most developing countries, sanitation and hygiene in India became the key areas for interventions for the COVID-19, for the pandemic. Next slide, please. So to give you a snapshot of facts on the WASH, water sanitation and hygiene practices in India, as you can see on the chart to the left, the access to drinking water in India's most populated states is not accessible to cover the entire population. Bihar, Madhya Pradesh, Maharashtra, UP, Bengal, which are some of the most populated states in India, also have poor coverage for WASH facilities for the drinking water. And you can also see how the cases for COVID are accordingly proportional there. When it comes to access to the community sanitation facilities, which is the chart to the right, once again, you see that a large part of population in these states does not have access to proper toilet facilities. They rely heavily on community latrines or community bathrooms. So again, all of these, a poor infrastructure has been one of the key bottlenecks in practicing safety for the COVID. And the hygiene, the hand washing habits also, the chart in the middle, you can see that again, a large population is not using water, proper methods for using water and soap for cleaning themselves. So overall, this has been one of the key challenges around preventing and taking those precautions for the COVID, for the pandemic. Next slide, please. So one of the key challenges, this is speaking from the perspective of the municipalities, has been around management of waste. With during the crisis, as we are going through it, the quantity of domestic hazardous waste, which the municipalities were not used to collecting, has been quite high, has been increasing, which has also led to increasing the risks for the sanitation staff and the waste collectors from the households. At the same time, infrastructure where these waste facilities, where this type of waste would be safely disposed, are also limited in the country, and for given the scale of the country. And as the last point illustrates, on average, more than 183 tons of COVID-related biomedical waste is now being generated per day, and which compares to an additional 609 metric tons that is being generated per day overall. So there is a large need for safe collection and safe disposal of this large quantity of waste that is being generated in the country. Next slide, please. So other than the households, a number of quarantine centers, screening centers, isolation wards were also set up to prevent the transmission, which were all areas for, again, generation of those biomedical waste. Not just waste, but also because these facilities were created in response, they were not adequately connected to the waste for proper management of wastewater, which also is infected from the virus. All pointing towards the lack of proper access to solid waste collection and disposal, as well as a municipal sewerage network that could in a safe way handle this the infected waste that is being collected from different areas. And as Inga pointed out, and as the speakers before me have pointed out, there remains a large need to increase awareness around health and hygiene, and also to look at use of important natural assets like the water consumption, which has also increased from people washing their hands more and using water for cleaning the surroundings as well. Next slide, please. So in these slides, I will like to focus on what the country has been doing. So in an effort to build back better, some examples from the waste sector, India released several guidelines on how to handle biomedical waste from hospitals, the quarantine facilities, and also from households. These were also subsequently revised over 4 to 5 times as lessons were being learned from ground operations and made more streamlined. Like I mentioned, there was never a history of looking at biomedical waste in the quantity from the domestic, from the homes and quarantine camps. So this was a completely new area. But the government of India has published quite a few guidelines that are available, at the following links for your reference. Next slide, please. In addition to that, from the aspect of the municipalities, like I mentioned, the biomedical waste, and as we all have observed from our respective regions and countries, also the PPE equipment and PPEs have been one of the major contributors. So to understand the life cycle assessments for safely disposing the large volumes of PPE that is being generated in an environmentally sound manner is another effort that is ongoing. And towards that, decentralized biomedical waste facilities have been increasing. So while the government has been establishing these efforts at the national and the local levels, there are several industries also that have taken initiatives to protect and to ensure safety of their workers, like the GMR Mahindra Reliance that have created isolation and quarantine centers at their premises to reduce the transmission. A number of IEC and awareness campaigns, particularly for the migrant workers, have also been put in place. And India, and in terms of the technology, India is also looking at how the wastewater can be, just to address this issue of contamination of wastewater. Some predictive modeling is being undertaken. Next slide, please. So I would like to now discuss a few interventions that UNHABITAT has been looking into towards improving, towards building back better. So we have tried to use the momentum and around around waste to look into how we can make more sustainable and long-term practices more mainstream into the way municipalities are thinking. So, for example, one of our interventions that we're discussing in a city, Vijayawada, on landfill remediation through Fukuoka method is looking at not just how to improve this existing dump site into a safe and secure landfill to trap leachate, reduce the harmful effects from the gas that gets trapped, but then to also over the long term see how this site, which is located next to a housing society, can be converted into a sports and recreational area. Another intervention that we have been able to look at is into recycling of flower waste. So in these two cities and in India overall, the cultural practices in place, a lot of flower waste is generated. In this case, almost 30 tons per month that is dumped into landfills. So again, we are providing technical support and advisory on project formulation so that this flower waste can be recycled, in the interest of, again, bringing attention to the circular economy and circular aspects to produce eco products, and also to involve self-help groups that would then create local jobs. Next slide, please. And another example of interventions. So with decentralization also being discussed quite a lot in terms of management of biomedical waste, we are piloting this concept of zero waste wards, which would look at minimizing waste, segregation, all kind of building the momentum for on one hand, improving the municipalities' capacities for waste collection, advocacy with the communities on proper waste recycling, and also to bring in elements of circular economy so that these decentralized units can be then scaled up to the city. And lastly, we continue to engage with the national and the state governments to improve the existing bylaws, policies and plans for solid waste management and WASH, and with the lens towards the targets set up under the SDG 11 and Agenda 2030. Also bringing in the lessons learned from various countries and also from India on management of plastic waste, which is one of the areas that has increased a lot post COVID because of the PPEs, and looking at other areas of waste management as well. So that'll end my presentation here, and look forward to the comments. Over to Yuan.
Thank you very much, Peru. Hello, my name is Juan Torres. I'm Information Management Officer here in Lao office. And the title of my presentation is COVID-19 Vulnerability Mapping Model for Lao PDR. Next slide, please. Lao PDR is located in the China Peninsula. Lao is a landlocked country bordering China, Myanmar, Thailand, Cambodia, and Vietnam. As you can see, Laos is not a large populated country, especially if you compare with the neighboring countries. Next slide, please. The variables applied for the vulnerability assessment model that we have conducted is population density, settlement connectivity, socioeconomic factors, migration, and access to healthcare services. Next slide, please. There are 4 main cities in Laos, but by conducting the spatial analysis with the GIS software, we have identified that other areas in the country where there is a high concentration of villages that, due to their proximity and connectivity, behave as new emerging cities. Next slide, please. By cross-checking this information with the population of those areas, we have found that besides the 4 main cities, almost 50% of the total population were located in urban areas or in these emerging towns. Next slide, please. Taking into consideration the given results and combining with the analysis of different socioeconomic factors, we came up with a vulnerability index and a detailed location of the potential most vulnerable areas in the country. This tool is providing us with valuable information to prioritize and conduct evidence-based interventions. Next slide, please. Laos is still a very complex context in the light of some of the WASH indicators. Many people are still using unimproved water sources. More than 20% of the households spend more than 30 minutes a day collecting water, and 10% of the households do not have hand washing facilities in their dwelling, and for the ones that do have, 46% do not have water or soap. People can be informed, but on top of that, people need wash facilities to be able to apply basic protection measures. There is a long way ahead, but working together with governments, international organizations, civil society, and private sector, we will be able to provide water and sanitation to a larger number of people and reduce the existing gaps. Next slide. Next slide, please. Lastly, I would like to show an example on how this vulnerability assessment model helped the government of Laos identify the priority quarantine centers where a high number of migrant returnees could be anticipated. UNHABITAT provides support to 6 quarantine centers in 4 of the most vulnerable provinces. The main activities have been focusing on ensuring the adoption of protective measures by constructing and rehabilitating wash infrastructure in the quarantine centers and providing information, education, and communication material to the returning migrants. And this is the end of my presentation. Thank you very much. And now I will let my colleague from Myanmar to take over.
Thank you, Juan. Thank you very much. Greetings from Myanmar to all of you, and thanks for this invitation to let us share what we have been doing in Myanmar. My presentation is about bridging the data gap for effective COVID-19 response in informal settlements in Yangon. Next slide, please. As it has been the case of many cities around the globe, also the cities of Myanmar have been hotspots of COVID-19 outbreak. As of today, we have more than 140,000 cases recorded, with the unfortunate date of over 3,000 people. Most of the cases have been located in the Yangon region, with 77% alone in the city of Yangon. As the United Nations Special Rapporteur on the right to housing has said, having no home, lacking space for physical distancing in overcrowded living areas, or having inadequate access to water and sanitation has become a death sentence for the most marginalized communities. Next, please. We see that while timely government response on groundwork by civil society groups, by volunteers, combined by the work of the United Nations, including UNHABITAT, has prevented a widespread outbreak of the COVID-19 in informal settlements, we can see now, 1 year after COVID has hit Myanmar, that the residents continue being both fearful of emerging outbreaks of the pandemic effect that has had in the economy, and that is worsening now because of the crisis that the country is going on. We see that there are several constraints that hamper the ability of informal settlements to address the gaps in data on informal settlements, especially those are related to access to health and access to wash facilities that have impaired the government ability to make informed response plans. We also see that there is a lack of access to accurate and updated information, truncated access to wash, healthcare services, and also the risk of the loss of income because of the mobility restrictions and the temporary suspension of businesses that have been implemented. And also the lack of affordability by the communities living in these informal settlements to buy protective equipment. Next one, please. In 2016, UNHABITAT has identified 423 pockets of informal settlements in the city of Yangon that house more or less about almost 500,000 of the population of the city. Deficient access to water, high density of the settlements, and insecure of tenurity, with all the risk of evictions, place residents of informal settlements at greater risk of getting COVID-19. Please, next one. We all know that the issues related to wash and public health are no access to adequate and safe water at the places of need, lack of awareness to sanitation, hygiene, and mostly practice, no proper solid waste collections. Some settlements do not have at all drainages or sewerage networks, and most of them face loss of livelihoods. Next one, please. So UNHABITAT in Myanmar, with the aim to provide a more effective response to COVID-19, have conducted a large survey in informal settlements of Yangon, not only to measure the impacts of COVID-19, but also to underscore the needs of the people living in these settlements. So we see that there has been a huge step fall in the household income. In 2020, April, we conducted a rapid assessment where we saw that 2% of the households earned less than $76 a month. But now in December, we saw this number increase to 40% of the households earning $76 a month. And we also saw in December 2020 that almost 8% of the households had no income at all. Next slide, please. Thank you. We all know that water is a key to combat COVID-19. However, we see in the informal settlements, just 6% of the population has piped water. And we have done tests in these settlements, and we see the high concentration of chlorine, sometimes 3 or 4 times higher than the permitted standard. Most of a third of the population in the informal settlements reported a neutral well as the primary source of drinking water. And still, over 25% of the population in these settlements depend on rainwater collection for drinking water. Most of the people living in informal settlements have to pay for the water they consume. This implies for them $7 a month out of the $76 they make. And 25% of the respondents in our informal settlements have said that financial constraints are the major difficulty for them to access drinking water. Next slide, please. Sanitation is also a major issue, as my colleagues have already mentioned. Although 90% of the households in our sample reported having access to their own latrine, as you can see here in the photo, this could be a typical latrine in informal settlements. These latrines are usually pit latrines. Out of those households without access to a toilet, more than half said they use the neighbor's toilet or they share a toilet with somebody else. And a third of these people needs to go to a public toilet. The informal settlements are located in urban areas, but as our colleague also said before, there is still practice of open defecation. Next slide, please. COVID-19 has also raised concerns on the contamination risk associated with waste management. There is a lot of PPAs that have contributed to increase the waste in the cities. We have seen that in our informal settlement sample, about 60% of all the households dispose their garbage at a community dumping site, and only less than 20% they do to the municipality's designated dumping site. The majority of the households do not pay any money for waste disposal services. And those who pay for them, they do it to a private waste collection services. Still, the municipality services are very low. It's only 27%. Thank you. Please, the next slide. Hand washing is a key to combat COVID-19. We have been saying this and repeating this. However, more than half of our population in these 7 townships wash their hands less than 5 times a day. A third of them has said that they cannot afford either to buy soap or to pay for extra water for hand washing. Although the majority of the people uses a mask, now we have seen during the last 3 months in Yangon, the use of mask is incredibly reducing. Many people say they can no longer use it because it's too hard to keep them on, or they cannot simply breathe. And next slide, please. Since the pandemic started, UNHABITAT has been tirelessly working to respond and to contribute to the government of Myanmar. We have started with an advocacy paper on housing that was released in May 2020, along with water and sanitation, putting housing at the forefront on the battle against COVID-19. We have been advocating to expand awareness raising and information dissemination to combat COVID-19. We also have been advocating to install hand washing stations at the strategic locations in informal settlements. We have been also targeting the supply of basic services to vulnerable communities, including access to water. And we have also been advocating to ensure that there is adequate access to water, soap, and sanitation facilities for the homeless people. As of today, we have benefited almost 150,000 people across Yangon. Next slide, please. So, with all these evidence-based interventions we have done and the service we have conducted, we see that there is a huge need still to bridge the data gap for effective COVID response. From the service we have conducted up to now, we have been able to implement interventions that have contributed to build a stronger awareness, not only on the impact that COVID has already caused, but also on the pressing needs of the informal settlements. This also has helped us for a strong advocacy and proven people-centered support that has opened opportunity for further response interventions, not only in the short, but also in the medium and long term. This evidence-based data has allowed us to design major programs to combat COVID-19 in Yangon. So we are going to initiate soon a new program to continue contributing to the population to fight COVID-19. So we are aiming to benefit more than 100,000 people through enhancing access to safe water and improving environmental sanitation in informal settlements, supported by solid waste management, and also improving the hygiene awareness and capacity of communities in informal settlements. Thank you very much. This is the end of my presentation, and I would like to.
Thank you. And first of all, thank you, my colleagues, for your excellent and concise, but very clear and to the point, and the presentation explanation. Also, I'd like to thank participants for your questions, to some of which our colleagues have already responded. But there are some questions which have not been responded yet. So one of the questions, that's the very beginning, which is a question about green growth and COVID, asked by, I'm still looking at the chat function. I cannot find the name, but this is about probably the part of the presentation by Abby, COVID and green growth. Can Abby respond quickly? We have about still 10 minutes, so maybe if you can quickly respond, we can pick up other questions as well. Abby, over to you.
Yeah, thank you, Atsushi-san. So when I was mentioning about green growth and recovery, it was looking through the lens of how to turn the challenges into opportunities. And the way we were presenting is that COVID-19, despite all the different challenges it has thrown at us, it also provides some opportunities for green growth and recovery, particularly if we look through the lens of reducing vulnerabilities or the case that Parul mentioned about building back better, or what we have seen the different initiatives undertaken in countries like Fiji and in Myanmar in informal settlements, like promoting people-centered and integrated development at various levels. So when I was talking about green growth and recovery, it is basically looking at the issue of strengthening capacity in terms of preparedness, recovery, and response. And of course, there has to be a strong focus on local governments and communities. And for example, in Laos, my colleague mentioned about the analysis they have carried out through the vulnerability mapping model, for example. It has given greater insights into ways settlements are sort of distributed in the country. And surprisingly, we found that about 48% of Lao population is sort of concentrated in 5 geographical areas. It also gives us a better understanding what are the challenges and how we can possibly respond to those challenges. Also, the issue about improving sustainable and inclusive access to basic services. I think this has also come to the fore in a much more, in an emphatic way. And I think it is also an opportunity. Also, there is an opportunity to improve and work on water monitoring tools, the quality, the safety standards. And finally, what I would say that also it is sort of increasing the awareness through education and communication strategies that we can sort of employ. So this was what I was trying to talk about when I mentioned about that how we can perhaps turn these challenges in these difficult times into opportunities. Thank you.
Thank you, Abby. I know that many participants want to ask more, and you can reach us anytime, individually to the country office or regional office, or through Yumiko-san. So, some colleagues have already responded some questions, but other colleagues want to respond and say something to the questions raised, like Inga or Parul have responded to some, but if you want to add, please go ahead.
Well, if I can just elaborate on my answer before real quick, the question was what can be done now in Fiji to increase climate resilience. And just from our work right now, I mean, I've talked about the data gap, but what we're doing at the moment is we're kind of like piloting potential solutions that can really address the issues I've been talking about, and that covers mainly flood-resistant sanitation options, for example, that work in various settings, be it in mangrove areas near river banks and in flood-prone areas, but also in dry land. So this is one step to really pilot what works, but then what really needs to happen is the scaling up and the rollout of large-scale infrastructure, climate resilient infrastructure investments. And that has not been on the agenda, on the main agenda of the Fijian government. So far, it's been really more focused on complete upgrading of one settlement rather than spreading out to cover more settlements, but with a more strategic intervention.
Thank you,
Over
Inga.
to you.
Yeah, thank you. Parul, would you like to add to your response to the question, or you okay? Over to you.
Yeah, so thank you, Robert. I will reach out. So the question was on this thing that we're finding out that the wastewater can also be contaminated, and the question was whether more studies are being undertaken by the government of India on the transmission of this virus through water. So I will reach out to the expert and ask them for more information. But like my colleagues have mentioned, because there are other questions I see on whether by Anthony Slater on whether governments are placing more priority on water sanitation services, especially in terms of budget and funding. So, from the perspective, from the case of India, I can certainly say that water sanitation and access to it in terms of both infrastructure within the cities, the networks, and other formats is certainly a big priority for the country. We have several national missions running, and there's the Swachh Bharat mission, the Clean India mission of the current government, which focused on eliminating open defecation, increasing access to toilet facilities, have been one of the highlights. And still a lot needs to be done. So like Inka had mentioned, and so has Avi, that our focus is now on how do we make these investments, how do we climate-proof these investments, how do we make sure that these investments are going to the areas that need them, they're more inclusive, and do not leave those underserviced pockets of the cities that are often overlooked due to regulatory constraints, for example, the redlining of districts or exclusion of certain pockets from the cities. So our effort in India of UNHABITAT is also now to use data and evidence and to bring the discussion back to leave no one behind in the efforts of government to focus on increasing the area investment in these areas.
Thank you, Inga. You finished?
Yes.
That was
Parul.
Sorry for that, Parul. But thank you, Parul, and your baby boy for joining us today. There's one request in the chat box, and this is about please share the slide. And this is, I think, over to Yumiko-san. How are you going to share the slide with participants?
Yes, the slide will be shared to you by email, and it will be also uploaded on APWF website.
Thank you. I think we have only 2-3 minutes left. So before closing and handing over back to the Secretariat, let me just mention a couple of things from UNHABITAT. UNHABITAT produced, where is it? This report, which is a World City Report 2020. And you can find it in our website. I mean, UNHABITAT, if you go to UNHABITAT website of our headquarters, you can easily, download those things. And this is published in, UN official languages, in different languages. That's one. And secondly, also UNHABITAT is now developing or almost finishing a new report, which is more about COVID, which is cities and pandemics. It's not yet finished, but it's forthcoming very soon. And there are many materials and information if you go and visit our website of our headquarters and also individual country offices. And as I mentioned, if you want to reach us for questions or offer of collaboration, it is welcome. And please contact us through Yumiko-san or directly to us. That's it from me. Unless there is any from our colleague. Before closing, our colleagues switched off their camera because it might affect the connection. But can I ask our colleagues to switch on your camera and say hello to the participants? Yes. So that's all from UNHABITAT, and back to you, Yumiko-san.
Thank you so much, Okore-san, for introducing the activity of UNHABITAT to respond to COVID-19 and also WASH and also disaster risk reduction. And it was very, very informative information, and we really would like to learn more about your activity. I thank you so much. I really appreciate your contribution to our APWF webinar. Thank you so much. I also thank you to all audience to join our APWF webinar with UNHABITAT. Before closing, I would like to introduce next APWF webinar. Next APWF webinar will be organized on 15th April. The topic is about engaging industry in sustainable water management through water stewardship. Ms. Megan McLeod kindly introduce the the brief introduction to water stewardship, and she will present practical example from industry across the region, particularly from Japan, China, Indonesia, and Australia, to drive sustainable action on water at site and also catchment and also supply chain level. Now, I really would like your continuous participation to the 9th APWF webinar. The registration URL will be also introduced to your email address and also our APWF webinar. Now, I would like to close this APWF webinar with UNHABITAT. Last but not least, I really would like to appreciate UNHABITAT to join this APWF webinar as a speaker. I thank you so much for your contribution and thank you so much for your collaboration for the future. Thank you. Now I would like to close. Thank you so much for all the audience. See you next time.
Thank you. Thank you all.
Thank you.